What is an allele in cystic fibrosis genetic testing? Imagine your genes as a set of instructions that make you who you are. In cystic fibrosis genetic testing, an allele is one of the two copies of the gene you inherit from your parents. Each person has two copies of the CFTR gene, one from the mother and one from the father. These copies can be normal or carry changes called mutations. When both copies have mutations that affect how the CFTR protein works, cystic fibrosis can develop. If only one copy has a mutation, the person is usually a carrier, meaning they don't have symptoms but can pass the mutation to their children. Genetic testing for cystic fibrosis looks closely at these CFTR gene alleles. The test checks for known mutations, especially the most common ones like delta F5, which is responsible for many cases of cystic fibrosis in different populations. If the test finds mutations in both alleles, it confirms a diagnosis of cystic fibrosis. If only one mutation is found, it indicates carrier status, meaning the person carries the gene change but does not have the disease. Sometimes, testing reveals more complex situations, such as mutations on the same allele, called in cis, or mutations on opposite alleles, called in trans. This distinction is important because cystic fibrosis symptoms usually occur when mutations are present on both different alleles, not when both are on the same one. Understanding what an allele is helps doctors interpret test results accurately. Since cystic fibrosis is an autosomal recessive condition, both alleles need to be affected for the disease to show up. That's why identifying mutations in both copies of the CFTR gene is key to diagnosis, carrier screening, and counseling. When genetic testing shows mutations on both alleles, it confirms cystic fibrosis. If only one mutation is found, it means the person is a carrier, which is important information for family planning. Genetic counseling is highly recommended to help individuals understand their results and what they mean for their health and their families. Remember, each person's genetic makeup is unique, and medical advice from healthcare professionals is essential for personalized care.